All right, I'm going to perform a lung examination on my cousin Chaz. So normally what we would do for, let me stand behind you, for a lung inspection is you would have to have them take off their shirt. But for the purposes of this video, I'm going to have him leave his shirt on, but just know that normally his shirt would be off. So I'm going to start anteriorly. I'm going to start with inspection. So I'm just looking at his chest. Normally his shirt would be off, so I'm looking for the color. I would say probably that there's no cyanosis. Looking for any masses or lesions, just looking for it based off inspection first. And now I'm going to gather my subjective data. So I'm going to ask you, have you had any pain while breathing?
No.
History of respiratory infection?
No.
Are you a smoker?
No.
Have you had any environmental exposures that would have led to you having difficulty breathing?
No.
No? Okay, so he answered no to all those questions. So now I'm going to go on to inspect the AP diameter compared to the transverse diameter. So the AP diameter is anterior to posterior, and this is his transverse diameter. And it should be that his AP diameter is half the size of his transverse diameter. So it's a 1-to-2 ratio. So next I'm going to palpate. I'm going to use my hands and start at the apices and go side to side and down, making sure I hit all lung fields. I'm going to be checking for crepitus, masses, tenderness, lesions. Sorry, I'm just going to palpate. And as I'm doing this, let me know if there's any tenderness or pain. I'm sorry. Any tenderness or pain?
No.
All right. I didn't feel any crepitus, which is that Rice Krispies feeling. There was no masses. He didn't say there was any pain or tenderness. So now I'm going to do it again, and I'm looking for tactile fremitus, and I'm going to ask the patient every time I do it to say blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay. So that was looking for tactile fremitus, which is present. Now I'm going to percuss. So I'm going to drum with my dominant hand, and I'm going to use my non-dominant hand, so my left hand, and I'm going to lay it laterally, starting at the apices, and I'm drumming in between the intercostal spaces, and I'm going to go side to side. So the intercostal spaces are the spaces between the ribs, and I'm just going to tap. I should be listening for resonance. All right, making sure you hit all, capture the base of the lung fields. Now I'm going to auscultate. I'm going to ask the patient to take a deep breath in and out. And the same thing, I'm going to start at the apices, and I'm going to go side to side, moving down each time. Take a deep breath in and out. In, out, in. In, out, in, out, in, out. All right. And so the sound that I heard was like, they say it should sound like wind going through the trees, which is normal, which is what I heard in all fields. So that is anterior examination of the lungs. Now, what you would do is, I'm going to turn him, it's on the spinning chair, posteriorly, and you're going to do the same thing all over again. But the only difference with the posterior is that now you palpate for symmetric chest expansion. So what you do with that is you make your hands in the shape of a butterfly, and you go 2/3 down his back, and you place it at the T vertebrae, T7 or T9. Now I'm going to have him breathe in, deep and out. Do it again. All right, and what should happen is that it should move out symmetrically, and that would be a good sign. That's what's supposed to happen. So if I'm to go all over again, I'm just going to verbalize. You would inspect, make sure there's no masses, lesion, no discoloration, making sure that there's no cyanosis. Then you're going to palpate, moving your hands side to side. Then you're going to ask the patient to say blue moon, ask for tactile fremitus, or looking for tactile fremitus. Then you're going to percuss with your dominant hand as the drum and your left hand laterally, side to side. You're doing that in between the intercostal spaces. You should hear resonance. And then you're going to auscultate and ask him to take deep breaths. And you should hear that sound of like wind going through the trees. And then, like I said, you palpate for symmetric chest expansion. And then when you're all done, you can say that there is vesicular sounds in all lung fields.